All right, your Pratt Pack on the road. Busy day as we go live to tape early in the afternoon, and I want to tell you that you need to get here just to see what they have available at this neighborhood hospital in Brentwood along Route 51. But if you are in the need of clinical care, this is the place to be. 36,000 square feet. It's more than just an emergency room. It's a full-blown hospital. So we're going to introduce everyone, but over my shoulder, the man, the myth, the legend from MediConnect. You know him from that show, Inside Connection, every Saturday at 9. Lance O'Brien. Now, this enrollment period is just around the bend for people my age, and I think that this would be a good way to start talking about why having a facility like this for people in my age category close to home is a really good idea.
Well, I think when people think about their health care, they think primarily about two things: staying healthy and what's it going to cost me, right? You know, I think that's where the marriage between the medical coverage that's provided by these great facilities and the work that we do, where people can feel confident in actually getting their coverage and getting their care.
Listen, let's be honest. You deal with a lot of healthcare providers, but we have a special place in our heart for AHN and Highmark. Talk about that partnership.
Yeah, amazing relationship. I love their impact in the community as a healthcare system and as an insurance provider. Really trying to, the heartbeat really of these hospitals is to get into the community, right? And be where the people are. We all know and could tell stories of how tragic it is to have to go to an ER and sit there for hours upon hours upon hours, and the challenge of that. I've been through that. I've been through that with a staph infection within the last 5 years. It's not a fun experience. So what they're doing and how they're positioning these hospitals in the region is a really big thing.
Yeah, the other thing that I've been doing for a number of years, the Allegheny Health Network, in conjunction with Highmark, a healthcare company, Medical Frontiers, with a good doctor, Dr. Gerald Pfeiffer. Every Monday night, we have all these great physician guests and people that come in with interesting stories to tell. Callers interact. And I can just tell you, it's an incredible brand, and any chance I get to promote it, I will, but especially these neighborhood hospitals. I was telling Cindy earlier, in Beaver County, Monaco, we have one of the cancer institutes. It has literally changed care for people dealing with cancer in Beaver County, being able to stay close to home. So what we're going to do now, let each one of our guests introduce themselves, tell everybody what they do, and then we're going to dive into some questions. So you first.
Hello, I'm Dr. David Sarkness. I'm the medical director of both AHN McCandless in the North Hills and AHN Brentwood here in the South Hills. I've been with the team here since we opened up all 4 hospitals about almost 5 years ago now. I would like to just add one other thing in terms of what people look for and what people give us high regards for, and that's our efficiency. This is not like your traditional emergency department where there's 2 and 4 and 6 hour waits. We get people in very quickly. We have staffs that work as a team, and we can get you in, seen, and a diagnosis and back home within a couple of hours at most.
All right, you next. Tell
Very
everybody.
good. I'm Cindy Durundo. I'm the regional CEO for the Neighborhood Hospital Market here in Western PA. So pleased, Julie and I had the pleasure of opening the hospitals, as Dave said, five plus 5.5 years ago. Hempfield was our first one that was open, and we're located in McCandless, Brentwood, and Harmer. So true pleasure to be here.
Julie, introduce yourself.
I'm Julie Ferentz. I'm the Regional Chief Nursing Officer for the neighborhood hospitals as well. Also had the pleasure to open the market with this great team, and really I run the operations of nursing that really just drives the quality of care, the efficiency of care, and not only making sure that our patients are safe, but our staff are safe as well.
All right, Cindy, so let's dive in a little bit and talk about how this is a fully licensed hospital, 24/7, 10 in-bed patient unit. Explain the inner workings of what we're witnessing here today.
Absolutely. So when patients have that need, right, our philosophy, our mission is providing care patients need in the neighborhoods they live, within care in teams they trust. So we really live that philosophy each and every day. So when patients present, Dave mentioned about the importance of efficiency and then patient experience, right? That experience, that time is important to patients, right? They're very vulnerable. They have that need to understand what's going on with them or their loved one. And so that importance, putting that pivotal time in terms of the patient being seen by whether it's a physician, a board certified physician, or an APP provider in our ED to find out what's going on. And then we talked about the needs within the care cycle, the efficiency, the patient flow, and having laboratory and radiology here within the department to really support those those focuses of flow to ensure that they have that quick diagnosis and then even quicker treatment.
You know, I think people like to see what's going on around them. I know anytime I've been in a hospital, I just kind of want to see what's going on. And the sightline with these nurses stations are absolutely up close and personal.
Right.
And it gives you such a sense of, well, tranquility to know that they're just really an arm's length away, right?
Absolutely. Our patient sightlines are one of the pivotal models associated with the neighborhood small format hospitals, so we're very blessed with that. Likewise, we have a lot of innovation supporting that physical layout that really assists the team to do everything that's patient-centered and swarm approach, so we can make that quicker diagnosis and again, get that patient treated. And if they do have a requirement to come to the inpatient unit for a bed, we can get them over there very quickly. So as Dave mentions, almost all of our metrics are at the top 5 or 10% nationally in terms of throughput.
Doc, let's talk about CT and X-ray procedure rooms that accommodate patients of any age with adjacent observation rooms to keep these families together. Talk about that.
Well, our X-ray department is, and CT department is one and the same, and it's no more than maybe 15 yards away from our rooms. So families know that their loved one is only that far away. We get X-rays, ultrasounds, CTs, read by a radiologist 24/7. So you come in at any time and you need an ultrasound, which is usually unheard of in the bigger hospitals. We'll get that test done and read within usually an hour. And that's almost unheard of in the ER world today.
Listen, response time is everything too, being able to
It
get
is.
seen. Sometimes you get held up because it's a big world that we live in, but here it really is intimate enough to where you can get that time definitely a lot quicker in many cases, right, Cindy?
Absolutely. So again, there's ebbs and flow of when patients present. Emergency departments, sometimes patients will come to us after, their PCP office is closed or they can't get into a local urgent care. We are not that urgent care, right? We're an emergency room. You come in, we're gonna respect that emergency, but we're gonna also respect the time that's needed and necessary to make that quick diagnosis and then initiate the treatment.
Julie, here's the other thing, and I've traveled 51, many times I've been out in this part of Pittsburgh for years, 30 years, and I know how it can become a bottleneck at times. So if you would have to go downtown to Allegheny General, that's really gonna cramp somebody's style. So just having the ability to walk out of your house, get into your car, come down over the hill here in Brentwood, you're here, right, Julie?
We're here, and the community has really adapted to us being here. We've become a pivotal part of their choices, whether it's Yelp reviews, Google reviews, our patient experience scores. The community loves that we're here, right? We're doing things in the community for them. We have our business development plan manager who's out doing things in the community. We work with our local EMS departments. We work with our local fire departments. We even work with the city of Pittsburgh for EMS. We're working with everybody in the community to educate them that we're here, why we're here, our efficiencies, and that we can treat that emergency and we will, get you faster in and faster out, or faster in, diagnose you, and move you right over across the hall. Our inpatient unit is within 15 feet from the emergency department, so it really is that team approach to the care here.
Go ahead, Doc, you wanna follow up on that a little bit? Anything else?
Again, I think that what sets us apart is our efficiency and how quickly patients can get their diagnosis. That's what I've seen working 14 years in a traditional emergency department prior to coming here. That was the most, that was the nicest thing, I think, for me in my career, but also for the patients. People like to get in, get seen, and feel like they're being cared for quickly. That happens here.
Everything is kind of old, it's new again. So I grew up in Beaver County. You had a hospital in Beaver Falls. I was born in Rochester, that hospital. We had a hospital in Aliquippa. So basically what you all are doing, Cindy, is kind of a throwback, but with all the modern technology, the bells and whistles. So it's really going into the neighborhoods, and that's what excites me so much about what you're doing.
Yeah, it's really the care where patients live when they need it, right? So it's all about, Julie will not promote herself, but it's all about the results associated with the patient's outcome as well. So not having, events that occur, infections in hospitals. Again, our stay is shorter, the likelihood of infection is almost zero for us. Our readmission rate is under 1%, which is unheard of nationally when you look at all of the acute care hospitals. So what we're doing is definitely different, Some of it's throwback because we're not overbuilding the format, right? We know what we can do and we do it well within our building. And if there's needs for continuity of care, if they need to have a cardiac cath or some other level of service, we facilitate all of that. We're on the same platform as AHN in terms of that Epic record. So all of that is seamless, that testing is done, doesn't have to be duplicated. So lots of efficiencies associated with our.
So here's the thing, you're sitting down with someone my age and you wanna set up a plan for Medicare, you look at that post office box where they live and you might wanna say, hey, look, being that you live West Mifflin, Brentwood, Clairton, maybe you might wanna consider, I'm just saying because that good care that you need, when you need it, is close to home. Make sense?
Yeah, it makes a lot of sense. I mean, for people with their health insurance, access is huge, right? Like, I wanna be able to go to the facilities that I can, see the doctors that I want to, and generally, if they can do that at a high level in their local community, that would be their first choice, right? And I think that's really a big hole that these hospitals are filling, is that they're providing that neighborhood hospital. And a funny story really quickly, our office is in Crafton, right? And I used to live in Bell Vernon. So every day I'm driving 51, and I remember when this was going up, I was like, wow, that's a really big urgent care, you know, because I really didn't know what was happening. And I think that's one of the things that people sometimes when they look at it, even to this day, and you guys can correct me if I'm wrong, they think, well, what is that really? Is that an urgent care? And I think the fact that you guys are able to not only bring immediate care from a hospital standpoint, but if it's a greater need than what this facility can handle, you're gonna be able to bypass them getting to Jefferson or Allegheny General because you've done the prep work here. I think that's really, really important.
It is access, all of those attribute to really a good patient outcome associated with a patient in critical need. So having the talent, you know, a building is a building, but what makes it special is really the talent, the skill set that these clinicians bring and providers to really bring it close to home.
Here's the best part of this whole story, and there are, I'm sure, a few more good stories, but what I like, I'm all about healthcare jobs. I talk about it all the time. The tens of thousands of people that work, from the nurses, clinicians, dietitians, you name it, surgeons, people that are involved in healthcare in this region, they too have a family, they have a life. So if I apply and I find out that you're right down the street so I can pick up the kids on, you know, at the bus stop, I'm all in. So this is really helping people who have jobs in healthcare too, right, Julie?
It is, and a lot of our folks that work here live in this neighborhood,
Yes.
right? They live here, so they love and really take ownership of their patients and of the hospital itself, because a lot of times they're taking care of a neighbor, a teacher, a community member that they maybe serve on the school board with, or that they do sports with. So they're seeing them at Friday night lights at football games or basketball games, and they're sharing family things. And that's really, like, they wanna care for them, right? They're caring for them just like they would their loved one, and they love that about them.
Listen, Cindy, thank you for letting me do this. Now I'm
Thank
gonna
you.
get the tour and I'll talk about it on the radio later in the week. But closing comments, go ahead.
Yeah, I think Julie encapsulated neighbors caring for neighbors. That's really one of our mottos, our taglines, and it's what we live and breathe every day. All of us are from Western PA, so we kind of have that interest of taking care of our communities, and so it's really nice to work alongside people that have that same kind of passion and drive.
Doc, go ahead, closing comments.
Yeah, I think that it's, the most important thing is that we can do everything that the big traditional big box hospital and emergency department can, we just do it better.
I like confidence. And you, I'll see you Saturday, and I'm sure we'll have a little bit to say about this as well.
Absolutely. Always interested in providing not just great health insurance options, but partnering and connecting people so that medical emergencies don't become financial emergencies.
Listen, AHN, Highmark, they're like family to me, and I'm just so happy to have this opportunity. I want to thank everyone, Nikki and Dan Laurent and the whole crew, for making this possible, and this guy and all of these folks, because this is what it's all about, neighbor helping neighbor, and that's what these neighborhood hospitals are all about. Don't forget, Doc Pipe and I back Monday night, another edition of the Allegheny Health Network program, Medical Frontiers, in conjunction with Highmark, a healthcare company. Much more later tonight with your Pratt Pack. Have a great day, everybody.